Hi, it's Dr. Tim and I'd like to welcome you to this session which is on breast implant corrections. Now, breast implants have been around for 50 years and we are now seeing more and more of the older implants coming in for either removal and replacement or just removal. And there are a lot of conditions for which corrections are required for breast implants that have been around for so long. The commonest reason for taking them out is capsular contracture. Now, what is capsular contracture? An implant introduced into the body creates a lining around it because the body thinks that it's foreign material and wants to isolate it from the body. So this lining is as thin as a glad wrap. Now, in 5% of individuals who have their breast implants below the muscle, and in 15 to 20% who have it above the muscle, this lining becomes as thick as an orange peel. And what that wants to do is that it wants to make this implant into the smallest surface area, which is a ball. That's why you see in people who have severe forms of capsular contracture, they have like coconuts on their chest. So some of the symptoms that you get with capsular contracture is distortion of the implants, and they also feel quite firm and hard, and lastly they can be quite tender and painful. So the way to correct the problem is to remove the capsule and the implant and make a new pocket and insert a new implant if that's what you desire. Now, there are a number of other causes for implant or reasons why we do breast implant corrections, and they are wrinkling and rippling, and that usually relates to saline implants. And what we do there is just replace them with silicone ones. The problem of synmastia, which is kissing of the breast implants. It looks like a loaf of bread or the figure of 8 sign. And the problem there is that the pockets are made too close so that the breast implants actually join in the midline. And what you need to do there is remove the implants and replace them in different pockets, usually underneath the muscle, if that could be done. The other reason for doing implant corrections is ptosis or sagging, and it's a little bit like the implant being stuck on the chest wall and the breast falling off the implant, a little bit like ice cream off an ice cream cone. And what you need to do there is just do a breast lift. The other two reasons are rupture of the implants. If you have a saline implant, it deflates. And if you have a silicone gel implant, the rupture can actually occur within that envelope of glad wrap, if you like, or it can actually rupture the envelope as well and go into the surrounding breast tissues. Now, that was a problem with the old implants because the silicone gel was of the consistency of egg white. The more newer 5th generation breast implants, the silicone gel is cohesive. In other words, it's like Turkish Delight, or in some cases even firmer, like Gummy Bear. And the last reason for doing implant corrections is size change. Quite interestingly, about 20% of women who have breast augmentation after a year or so decide that they want bigger implants. And it's a simple matter of removing the breast implants and putting bigger size in, making the pocket a little bit bigger to accommodate it, of course. So I hope this has been of some value to you. I'm Dr. Tim. Thanks for watching. Bye-bye.